Any questions?
Yes, Patrick, we had the first question we had pertained to your mentioning that there were changes to the ICS, and it was pertaining to recertifications. What is the period of time when it would be important to recertify your Fema certifications?
I don't think the Fema ICS certifications expire. However, first aid CPR, AED does, EMR does, EMT does, and it's generally every 2 years. Generally speaking, I recommend you retake everything every 2 years. Just follow that pattern. Retake the CERT training, go through the Fema ICS courses again. It's a good 2 years is about probably as long as you can remember anything, unless you're doing it consistently. And again, most of us are not. So I think 2 years.
Okay, fantastic. There were another few other questions, but I think they were answered. One of the questions was, does the scribe need to keep it 214, or is any written record sufficient? I responded to mentioning that if the scribe has CERT forms available on a clipboard, it's going to be great. It's ideal. But when that's not available, and it might not be, even a spiral notebook will get the job done. But when they don't have the forms, it naturally places more onus on the scribe because they're going to lack the guide that having that template provides, and using that form helps ensure that all the critical elements they need to capture are captured and not forgotten about in the heat of the moment, or by a scribe who doesn't have enough experience in that role.
Yeah, the forms make it easy, but a blank sheet of paper that's usable in a pinch, for sure.
Right. I mean, the most important thing is to capture as much as you can as a scribe. I mean, if you've got a form, that's great. Another question is, is there a recommended location for EMR and EMT training?
Community colleges tend to have EMT classes. We do have Red Cross does occasionally teach EMR, emergency medical responder. Community colleges do also teach emergency medical responder. I will tell you the difference between the two. EMT is at minimum 120 hours. It is designed for people who are going to be riding an ambulance, transporting people to definitive care. You learn a good amount about anatomy. Emergency medical responder is considered a step down from EMR. It's the next level below it. It's roughly a 65 to 70 hour class, depending on who's teaching it. You're actually going to learn a little bit more first aid in EMR than you will in EMT, because you're not expected to be transporting to definitive care. You're in the field, you're taking care of somebody, and you don't have an ambulance with you. You don't learn as much anatomy. It's the anatomy portion of it and a couple extra skills that make up the difference between EMR and EMT.
Doreen Sanchez. Doreen, if you could please unmute yourself and ask your question.
Good evening. I was wondering if you were going to provide bilingual videos of this, where you're going to have your videos translated into Spanish or Korean, other languages. Thank you.
I don't have the resources to do that, but if somebody is interested in transcribing or translating, I would be more than happy to work with them.
Thank you.
The next person with a hand raised was Nancy Darling. Nancy, could you please unmute yourself and ask your question?
Affirmative, unmuted. When we are checking a patient for their sensation and verbal, and if they can speak back, we need to also confirm checking for bracelets or necklaces that in hearing aids, making sure that this person can actually hear you. It could be that they just are deaf or hard of hearing. So we need to be able to not be on top of them, certainly that's personal space, but be able to be where they can see us and have the opportunity to respond. And don't yell at people, but we need to be, maybe they don't understand English and maybe they don't hear you. Patrick, very great presentation. I think we can all go into EMT with a good background. So thank you. Okay, I am finished. Back to net control. Back to Patrick.
Thank you. And you're absolutely correct. And I should have mentioned that. Part of the focused assessment is looking for jewelry, medical jewelry. A lot of times it's going to tell you something useful, allergies, heart condition, what medications they're on. Presence of a hearing aid obviously is going to be relevant. You're looking for something out of the ordinary, and that medical jewelry, that hearing aid should be considered out of the ordinary. Thank you.
The next raised hand is SBB. SBB, if you can unmute yourself and ask your question. SBB had actually posted that in the chat channel. He mentioned, thank you, Patrick. When I held that guy together, the one I told you about, it's really important to keep them talking and awake.
Yes. You're there to help people. You should be compassionate. You should not, and I was at, I don't want to be too detailed, especially since this is going to be online. I was at a drill that took place. It was an airport airplane crash scenario, and their local fire department showed up, and they were very clinical. They didn't care about us, and it was easily sensed. They didn't let us know that they were there to help us, and it was to the point where we started getting upset. We were bored, and we actually had somebody get up and wander away. And we told them when they failed to notice this, I think that guy is wandering away. I think he's he's injured, and they ignored us and let this person wander. Don't do that. Listen to what they're saying. Yes, they might be delusional. There might be something else wrong with them, and what they're saying doesn't make sense. But be compassionate. You're there to help. And if you're compassionate and you're talking to them and trying to let them know that you're there for them, it's going to put them more at ease. They're going to feel better about the situation they're in, which is probably the worst day of their life at that point.
SBB had another question. His question is, what if the patient is deaf and they can't hear you? Because he can speak sign language, but a limited amount.
They're gonna generally let you know that. And this is why it's you want to be in front of them, and this was mentioned earlier. You want to be in eye contact with them. Don't approach somebody from where they can't see you. Approach them from the front, make sure they can see you, make sure you make eye contact with them. If they're deaf or mute and they can't communicate that way, they're going to try and let you know this visually with their hands. They're going to indicate in some way that this is the case. But also, unfortunately, you might not realize that, or there might be something else going on and they can't. You're going to do the best you can with what you have.
One possible suggestion is if you have a scribe present, they may be able to give you a piece of paper and a spare pencil or pen, and you may be able to communicate via writing with the person who only is using sign language.
And that's true. And the other thing you can do if there's someone who does not speak English and you only speak English, if you have your cell phone and a translator app, like a Google Translate or Microsoft Translator, it can actually speak for you in the translated language and can record what they say and translate it back. And you can actually download the language pack so they can work offline. That's a good way to get around that.
Okay, one question for Daryl. I see that you put up a little clipboard of first aid cards. Where did you find those?
On the internet, just as examples of first aid cards, first aid flashcards. There's a wide variety of these. Some include illustrations. Some are just text, sort of bullet points to remind you of the proper steps and the proper things to go through. And having these in your CERT bag or backpack might be handy, because when things are happening, it sometimes little reminders could make all the difference.
Right. I was thinking of just make a personal one that says, hi, my name is Nancy. I'm trained in first aid. May I help you? While I'm checking for, other things, can they respond and so forth. That was a good point that was brought up. If your person is deaf or hard of hearing, if you could assess a lot of things by talking about that little card. So I'm gonna laminate one up and put it in my bag.
I've done the exact same thing. I've got my own checklists. I've got them laminated. I've got local maps. They're laminated. I've got dry erase markers. Anything you can put in that pack that you can conceive of that would be of value in a situation where there's no internet, there's no power, there might be smoke, might be confusion, fires, etc. Having that, you won't be able to do it at that point in time. After the fact, you have to do it now. And so preparation is key.
And no bloody gloves, so you have the other partner get them out. So.
Yes,
okay, thanks
please.
a lot, guys.
Please don't leave moulage in my medical kit. Or worse.
We have another raised hand from Maritza Alvarez. Maritza, if you can unmute yourself and please ask your question.
Hi. Hello. Hi. Can I be heard?
Yes, we can hear you.
Okay, great. Thank you. Thank you very much, Patrick. I did take the CERT training a few years back. Thank you for clarifying that every 2 years it's a good idea to take the courses again. So I had two questions. One of them was, during the time of COVID, how is one to perform CPR? And then my second question is, can someone take the Stop the Bleeding courses?
You're gonna have to look around to see who's offering Stop the Bleed. If you have a group that's with you and you have someone who can get certified to teach Stop the Bleed, they can teach it. In terms of CPR during a respiratory disease pandemic, it's a lot of this is going to be up to you, what your comfort level is. Are you comfortable being around a bunch of people who might be infected? If you're first aid trained even now, or above first aid training, you know that you're not going to be doing mouth to mouth. You're absolutely going to only use a barrier device or a BVM or something else. This is to protect you. This is to protect the survivor you're working on. If you can't do hands-only CPR, it works and it's better than nothing, but you don't want to put yourself at risk. Now, if you do have a rescue mask that has a one-way valve on it, that at least is going to protect you from them. Now, if you're infected with COVID and you're doing CPR on somebody and using a one-way valve, you're going to infect them, but at that point, they're already dead. They have no pulse. They're not breathing. So hopefully they would appreciate you bringing them back to life, even if you give them COVID.
Right. Okay. Thank you very much.
Nancy raised her hand. Nancy, go ahead.
Actually, well, he caught it when I was in the chat room there. That check with the Huntington Memorial Hospital for Stop the Bleed. We offered that up at the Altadena Tanner Country Club. It was a rainy night. We had 60 participants attend that class, and it gave all of our amateur radio people a great deal of confidence, because as you know, with radio, we could be up on Highway 2 or we're away from other facilities. We want to be able to help each other. Mm-hmm. Stop the Bleed is something that all of us can do, and it provides a lot of confidence on how to, like Patrick was saying, if the person's going to bleed out, first you have to stop the bleeding. That's it, and then you can worry about hands CPR or whatever else, you raise the feet or not. But really encourage you to Stop the Bleed. Look it up, and there's information available online that will give you some of the skills, but you may not get the piece of paper. But it's the skills that will really carry us through an emergency. So look that up, and you can do it. So that's it. Back to you.
Absolutely. Thank you.
Right. Robert Davidson had also mentioned that the Beverly Hills Fire Department also offers Stop the Bleed classes. And that seems to be all questions.
All right. Then thank you everybody for coming. Thank you for attending.